It's a story we've been following, potential cuts to Medicaid in Utah and across the country. I'm Fox 13's Robin O'Guinye. I heard the latest from a local organization on what those cuts could look like and who they would affect most.
My name is Angela, and I want to share with you a story of my family.
A story that is shared among more than 350,000 Utahns. The beginning and endings may differ, but it's the plot in the middle that's the same.
With my first daughter, Aubrielle, she passed, by the time she passed away, I think it was something like $310,000 in medical bills. And I wasn't even done with my medical bills. I had other medical issues on top of that.
Angela's first child was born premature, as well as two of her other daughters who now live with epilepsy. Thanks to Medicaid, Angela and her family were able to avoid a fate that would have made it difficult to financially recover.
We would have definitely had to probably go through bankruptcy. I'm 100% sure. I don't know how we could have ever started a family and paid for all of that early on.
But the threat of cuts to Medicaid at the state and federal level has many patients on edge in Utah, including many patients with disabilities.
Well, I think that's the real question is what are the cuts being made? I mean, there's so much conversation at the federal level. We don't have all the specifics yet. But for example, if it's a work requirement, they're saying it's directed at able-bodied adults, but we know that 60% of those on Medicaid expansion are people with mental illness or substance use disorder. So there's no world where we're not going to impact people with disabilities if we're putting a work requirement on. If they have to jump through these hoops to get on Medicaid or to keep their Medicaid, ultimately it's going to kick people off of it.
According to Protect Medicaid Utah, a coalition of healthcare advocates and consumers, Medicaid cuts would threaten 7,000 jobs across the state, and recipients have to complete at least 48 job applications in order to access treatments. Utah would lose $500 million in federal funding every year, and the rate of those uninsured would increase, leaving hospitals with millions in uncompensated care, creating a ripple effect for other consumers left with a higher price tag for their health care.
If it's a per capita cap or a block grant at the federal level, it's going to reduce the amount of money the state gets to provide Medicaid across the state. So the state might have to look at cutting what are going to be called optional services. That could be waivers that provide services to people with disabilities to remain in their home and not go into institutional settings. There's a lot of different things that could happen. So it really depends on what those cuts are, but a lot of these things are being discussed. And there's talk of reducing the federal matching percentage of expansion, which means our state has a trigger law, which means expansion ends the following July.
For now, Protect Medicaid Utah says the fight has to be taken to the state and United States capitals.
If you want to support the disability community, don't cut Medicaid. Medicaid, again, is one of, if not the most important program to Utahns with disabilities, and cutting something like that, making it harder for them to access it, is going to have a devastating impact on families, on individuals.
An impact this former Medicaid patient hopes no one has to face.
I think there's a lot of young parents out there that are also going to need help in the future. I worry about the younger generations and getting that little bit of help while they're trying to get into their careers for the rest of their lives.
If you want to know how you can help champion continued Medicaid coverage for everyone in Utah, you can do that by visiting Protect Medicaid Utah's newly launched website. You can find the official link to it with this story on fox13now.com. They also have a guide on how to sign up for Medicaid if you need it. Robin O'Guinye, Fox 13 News, Utah.